Yes, hello everyone. Good evening and welcome to our webinar. Um, this is our Cecelia Health webinar that we do once a month, a different topic related to diabetes management. We're so happy you could join us this evening. The subject happens to be blood sugar boot camp tonight, so we'll talk all about the ins and outs of blood sugar testing. Should you have any technical difficulties during the broadcast, there is a phone number at the bottom of your screen that you can call Log Me In Support. The number is 1-800-263-6317. There's also a webinar ID that you can reference at the bottom of the screen should you have any trouble. So we're so happy you could join us this evening. Our format includes a short presentation followed by an interactive discussion. To type in a question, use the questions section of the webinar toolbar. At the end, you'll have a chance to ask questions. So we look forward to an interactive webinar this evening. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes. Please consult your physician before making any changes to your current routine. This online Q&A session is intended to give general advice only. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecelia Health Certified Diabetes Care and Education Specialist. Our speaker or our webinar leader this evening is Ms. Leila Salick Davidson. Leila has a bachelor's in nursing degree from St. Anthony College of Nursing in Illinois. She's been a practicing registered nurse with 15 years experience providing care and diabetes education to patients in endocrinology, nephrology, and primary care. She has been a certified diabetes care and education specialist for the past 7 years. She loves spending time outside, gardening, cooking, bird watching, and spending time with her family and friends. She also enjoys empowering and educating patients to make individualized lifestyle changes and personalized goals toward optimal health. So, thank you so much for being with us this evening, Leila, and sharing your expertise. So, you may take it away.
Thank you, Katie. Welcome, everyone. I am happy to be here with all of you, and I'm thankful that you're spending the evening and spending some time with us. So I'm just going to go over the agenda a little bit so you know where we're going to discuss this evening. So we're going to talk about why check your blood glucose and why is self-monitoring your glucose important. We're going to discuss when and how to check your blood glucose, keeping a log, target ranges and managing highs and lows, dawn phenomenon, ketoacidosis and checking for ketones, what an A1C is and what estimated average glucose or an EAG, questions, answers, and sharing. And please remember to use the question box and we will address questions at the end. And I just want to remind everyone to please talk with your healthcare provider before making any changes to your diabetes treatment plan. So benefits of checking your blood sugar. Checking your blood sugar helps to give us an idea or a picture of what our body is telling us. And it also helps us to determine and work with your healthcare providers and for you provide individual care so we can prevent complications from diabetes and help you to live a healthy life. It also helps us to keep your blood glucose in range to prevent or delay complications. You can see blood glucose rises and falls throughout the day depending on what time of the day you check your blood glucose. It helps to determine steps in which we utilize to make treatment plans changes. And it's important if you're taking any medications to look and see, is the medication working? Do we need to make some different changes, whether it's oral medications or insulin? If you're having a hard time controlling blood glucose levels, looking at warning signs if you're having hypoglycemia or low blood sugars. and then if you would have ketones from high blood glucose levels. So what are some benefits of checking your blood sugar? So these items might increase your blood sugar, and again, this is individualized for every patient. What might increase or decrease someone's blood sugar can be different for another individual. So physical activity, sometimes certain exercises can increase or decrease a blood glucose. Stress, any illness or sickness, infection. If you're eating a meal, whether it's too many carbs or fats or proteins, what else are you eating with that meal will make a difference and how it affects your blood glucose. If you're not taking enough medication, whether it's insulin or oral diabetes medications. If you would miss a meal or a snack, not eating enough carbohydrates, alcohol intake on an empty stomach. How and when to check your blood sugar. So how you check your blood glucose, you always want to make sure you wash your hands before you check your blood glucose. Make sure they're completely dry. You don't want to have any extra liquid or water or soap on your hands. That can affect your reading. You would insert your blood glucose monitoring strip. It's also important to make sure your test strips or your glucose strips are not expired. So looking at the date on the side of your strips. Using your lancet device on the side of a fingertip instead of the middle. That tends to hurt a little bit less. And it's also good practice to change your lancet after each use. Then you want to touch your blood right on the test strip. It's usually on the top depending on your meter strip, and sometimes it's on the side of your strip. And then usually within a few seconds, your blood glucose level will appear on your meter. And when to check your blood glucose. Again, this is very individualized depending on a patient. Typically, if you're on oral medications, you check your blood glucose once a day. If you're on insulin, typically 3 times a day, and again, varying times of the day. So an option would be check your fasting glucose, which is usually in the morning, before breakfast, before you eat or drink anything, before meals, and 2 hours after the start of the meal. You might want to check at bedtime. Sometimes if you're waking in the middle of the night, you're not able to sleep, tossing and turning, that's also a great chance to check your blood glucose to see if it's high or low and if you need to make changes. In setting up an individual plan with your provider, asking your healthcare provider when and how often is right for you is always beneficial. Keeping a log. I don't know how many of you keep a log, but there's lots of different ways to keep a log. You can download or utilize blood glucose logs. A lot of providers' offices also have them if you would like to have it in hand. Sometimes you might want to use a calendar, and otherwise you can use lots of different smartphone apps. Here are just a few that are listed. My Sugar Diabetes Logbook, My Glucose Buddy, On Track Diabetes, Diabetes Tracker, Diabetic Connect, BG Monitor Diabetes. And it's important when you're keeping a log to record the date and time, what your blood sugar result was. And it's always helpful for yourself when you go back and look at your readings to make little notes, or if you're going to see your healthcare professional, they might ask some questions and it's hard to remember what we did a couple of days ago or a month ago, depending on how often you see your healthcare professional. Some notes you could make, meal details, If you were feeling sick, you had a headache, you were tired, stressed, feelings and emotions, and exercise are all beneficial to keep notes. Target ranges. So the American Diabetes Association has target ranges that are set, and these ranges will help to ensure that we can prevent some complications from happening and keeping your glucose readings in range. So before meals, that's also known as preprandial blood glucose readings. We would like you between 70 and 130 milligrams per deciliter. 2 hours after beginning the meal is also known as postprandial blood glucose readings. And we would like those less than 180 milligrams per deciliter. Hemoglobin A1C or an A1C percent. Target range would be 7% or an EAG, an estimated average glucose of 154. And again, like I mentioned, this is very individualized based on lots of different factors. Your age, if you have any medical conditions, the duration, how long have you had diabetes, hypoglycemia unawareness, where you don't have any sense or symptoms of hypoglycemia or low blood sugars, known cardiovascular disease or other advanced microvascular conditions, and individual patient considerations. Do you live alone? Do you have other medical conditions? Again, that is a big factor that plays on very individualized goals. And postprandial glucose readings might be in target if your A1C goals are not met. It's always good to look at your preprandial readings and your postprandial readings. If one of them is in range, your A1C may be out of range, and thus one of the postprandial or preprandial before or after meals may be out of range. Hypoglycemia or low blood glucose or blood sugar, excuse me. Hypoglycemia is when someone might have too much insulin or not enough food. Some different causes of this: not eating enough carbohydrates, if you took more insulin than needed, if you did certain exercise, some different symptoms. And again, just because these symptoms are on here, you might have a different symptom. Again, it's very individualized, but some common symptoms would be shakiness, sweating, weakness, rapid heartbeat. Sometimes you might just not feel well. It's always good to check your blood sugar. Treatment. Treatment for low blood sugars is rule of 15, where you would eat 15 to 20 grams of fast or quick acting carbohydrates. Some examples would be fruit, a piece of bread, candy, Smarties, Sweet Tarts. You could even use a tablespoon of honey or sugar, jelly, something to quick bring your blood sugar up. And then it's important to recheck in 15 minutes. That's where the second part of rule of 15 comes in. And if your blood sugar is still not above 70, then you follow with 15 grams of long-lasting carbs. You want to have another 15 grams of carbs, and you keep repeating that until your blood sugar is above 70. Hyperglycemia or high blood glucose readings. You might not have enough insulin or enough oral medications. Might need to add something else to your medication management. If your insulin's not working properly, Sometimes people will develop scar tissue from injecting in the same area often, which causes your insulin not to absorb properly. Some causes of high blood glucose readings or hyperglycemia: stress, illness, infection, certain medications, steroids, having too many carbohydrates, not enough exercise. Some symptoms of hyperglycemia or high blood glucose: increased urination, increased thirst. Again, you might have symptoms that are similar to hypoglycemia. You might have headaches, blurry vision. Some treatment, looking at what types of foods you ate before. Maybe it was for a birthday and you ate more carbohydrates than you generally do. Maybe you had cake and ice cream, had a little bit bigger of a portion. So looking at what did you eat and being mindful of that to make a change for that meal plan. Hydration, drinking fluids like water. Increase or change in medications. Again, it's always recommended to reach out to your healthcare professional if you're having hypoglycemia or hyperglycemia to look at a medication change. Or physical activity can also help to lower blood glucose readings. Ketoacidosis and checking for ketones. So what is ketoacidosis? It's when your body does not have enough insulin. And thus, if your body doesn't have enough insulin, we can't get that glucose out of your bloodstream and into your cells to be used for energy or fuel. So what happens? Your body will break down fat for energy. And when our body does this, it makes waste products from fat, which are also known as ketones. And our body tries to get rid or excrete this through our urine. What happens is these waste products or ketones build up in toxic levels in our body and in our blood, which can be very serious. So what to do? Checking for ketones. You want to check for ketones if your blood glucose is over 300 milligrams per deciliter. If you're not feeling well, you might have severe or abdominal pain. You might have nausea or vomiting. You're sick, you have a cold, flu. Even if your blood sugars are normal, it's important to check for ketones. If you're feeling tired all of the time, you might have an increased thirst, very dry mouth. You might feel like you look more red or flushed. You might have a hard time breathing. Your breath might smell fruity. You might not notice it, but a loved one or a family member or friend, coworker might notice that you have a fruity smelling breath. You might feel like you're not thinking clearly, like you're in a fog, or you might feel confused. Down here in the bottom right are what keto sticks look like. And you would just use that strip, dip it in some urine, and you can read it on the scale on the side of the bottle. Dawn phenomenon. All people have dawn phenomenon, whether they have diabetes or not. What happens is around 4 to 5 a.m. in the early morning hours, hopefully when everybody's sleeping, our body's still working and it produces a surge of hormones during this time. And people with diabetes don't have a normal insulin response to adjust for these higher blood glucose readings, which can happen when your hormones are changing. And what happens is you might see a higher glucose reading in the morning hours. Sometimes, again, talking to your healthcare professional, they might have you check at different times of the day to see if this is what's happening or if it might be something different. They might have you check before bed, in the middle of the night if you're waking, and then in the morning. So some steps that can help with this dawn phenomenon to help your blood sugars not rising in the morning hours is eating an early evening meal. This, can sometimes help. It can also reducing the amounts of carbs, and being mindful of how many carbs you're eating at that evening meal or an evening snack can make a difference. Do some activity after dinner, like going for a walk, um, doing some R exercises, yoga, some type of activity after your dinner meal, a lot of times can help. And if your fasting glucose continues to be high after making some changes, again, it's always important to reach out to your healthcare provider. You might need a change in medications, an increase, or just a completely revamp. So what is an A1C and an EAG, which stands for an estimated average glucose? So what these tell us is it kind of gives us a picture of what your average glucose has been over the last 2 to 3 months. That's typically a blood draw you do every 2 to 3 months based on what your A1C is. So if your A1C is in range or in target, as we mentioned earlier, based on your age and certain comorbidities, your individualized treatment plan. So if your A1C is 7% or less, that's typically checked about 6 months. If it's above range, checking about every 2 to 3 months. And what this tells us is it represents what your glucose levels have been over that whole 24-hour period, every single day for that 3-month period in time. It includes all of your blood glucose levels and readings during that whole time, before meals, after meals, bedtime, in the middle of the night. So SMBG, or self-monitoring blood glucose, it measures that single moment in time. So for example, this was mentioned a little bit in a slide before, but if you check your blood glucose every morning, so pre-prandial readings before you eat or drink anything, and let's say your blood sugars are all in target range in that 80 to 130 range, and your A1C reads higher, that could be because of those other readings at other times of the day that you don't check. So results give us an idea of, how is your diabetes? How is the medications working? How is your lifestyle changes or modifications working, whether it's exercise, eating, your overall health? How is that all working together? And then sharing your blood glucose results with your provider. So you and your provider can come with an individualized plan to help manage your A1C and estimated average glucose. And when you monitor or check your A1C, you can see how differences in your control are made. Like let's say these past 3 months were working on lifestyle changes. Since it's been nice weather, you've been outside walking more, being in your garden more of movement. A lot of times patients will see an improvement in glucose readings when the weather is nicer, being in the Midwest, and then in the fall when we're not moving around as much, your A1C might go up a little bit. This is just a really nice sheet that gives on the left-hand side what your A1C percent range is, and then on the left, and then on the right is your estimated average glucose. So if you look at this, and we mentioned earlier, an A1C of 7% would be an estimated average glucose of about 154. There is a great website I want to share with all of you. It's the American Diabetes Association. And if you'd like to write down diabetes.org, it's a great resource to utilize. They actually do have this little calculator, and you can base it off of your EAG, or estimated average glucose, based on what your average on your meter is telling you. A lot of blood glucose meters do give you a 7, 14, or 30. Some will also give you a 90-day average. You can go right to diabetes.org, type in, let's say your average glucose for 90 days on your meter was 212. So if we would look at 212 here and we go across, the A1C would be around 9%. So I love that tool. Diabetes.org has lots of information, and great articles, lifestyle, so much great information on there. So again, if you have a question, please feel free to utilize the question box below, and we will go through questions. I know one of the questions I get from a lot of patients is how many carbohydrates is in a carb choice. Some patients are asked to count carbohydrates, and others are asked to use a carb choice. So there is 15 grams of carbohydrates in one carb choice. Here is a great question. How many carbs should I eat for a typical meal? So again, that can be very individualized based on if you have any other health issues. And then if you would have, want to lose weight, you want to gain weight, working with a diabetes educator, your physician, or a registered dietitian, you guys will help to develop an individualized nutrition plan. Based on the American Diabetes Association general, we say 45 to 60 grams of carbohydrates per meal. And for a snack, that's based on 10 to 20 grams of carbs per snack. Again, that is from the American Diabetes Association, and it's always beneficial to meet with, your healthcare professionals so you guys can come up with a plan together. So here's another question here. I checked my blood sugar before dinner and it's 143. I have a good meal. And you walk 3 blocks to a ball game and your blood sugar crashes. How does this happen? So depending on what types of food you're eating at that time, like how many carbs, and if you're taking certain medications. Sometimes, for example, if you were on a sulfonylurea, which would be like glipizide, glimepiride, those medications kind of cattle prod or poke your pancreas. So the timing of the medications can make a difference in what happens to your blood sugar. Same for insulin. So you might need to look at what medications you're taking, the timing, and work with your healthcare professional to see if that needs to be tweaked. Maybe on the days that you are more active, maybe you take less medications based on what your provider tells you. Great question. So daily carb range for a 75-year-old with an A1C of 7.5%. Again, it's always great to meet with a registered dietitian or certified diabetes care and education specialist to come up with an individual plan. It's going to be dependent on any other health conditions you might have. Do you have heart issues? Do you have kidney issues? And then do you want to lose weight, gain weight? That is going to be very individualized. So sorry, I can't give you a specific number. Great questions, guys. I don't like to exercise, so how can I be more active? Sometimes, I myself don't like to say I'm going to go out and exercise. It's not motivating to me, but me going outside and doing gardening, taking my dogs for a walk, that kind of seems to help me be more motivated when I make it not exercise for myself. So just think about being active, moving around more. Um, Set an alarm or a timer if you sit down and kind of lounge on the couch and read or watch TV or you're on a computer, to just move around more. Sometimes patients will use a Fitbit. And then just get up and move around, whether it's marching in place. Maybe you want to do a load of laundry between, your time sitting there kind of sedentary. So getting up every 30 to 60 minutes to just move around. And think about when you're moving around, that is going to help get that glucose or sugar out of your bloodstream and into your cells to be used for energy. We'll give it another minute. Does anyone have any other questions? And I would just like to mention it's always important to have your blood glucose meter with you and to carry carbohydrate source or something if you would feel low when you're out, exercising or, at your bedside, keeping it right next to your bed, or when you're out driving. You never know when, something's going to happen. So having something with you at all times, maybe you're running around to some stores and you just didn't have time to stop and get food and you're feeling a little weird. Check your blood sugar, see where you're at. You might need to treat yourself, especially if you're missing a meal, depending on what type and amount of medications you're taking. Some of the medications, it's really good to make sure you're eating meals between so that you're not going to run the risk of getting low blood sugars. And if you get too low, same with too high, you might not feel well. So, trying to drive your car when you don't feel well is very hard. So pull over, and it's, again, keeping something in your car that's not going to melt, especially when we have some hot days. Some of the hard candy or Smarties or Sweet Tarts, something not chocolate. You might come to a chocolate mess in your glove box. Well, that's all the questions we have. And I have a couple of more slides I just want to share with you guys. There's some of the next upcoming live events. September 14th, that will be 6 p.m. Eastern or 5 p.m. Central Standard Time. It's a happy heart is a healthy heart. October 19th of this year at 6 p.m. Eastern Standard Time or 5 p.m. Central. Diabetes 101, Mastering the Essentials. Those sound like great webinars. Some additional Cecelia Health resources. There is an awesome Facebook group. Again, the link's right here, but it's www.facebook.com/groups/diabetes innovation on hub, or excuse me, diabetes innovation hub. And then there is the Cecelia Health blog, and that web address is https://www.ceciliahealth.com en-us/blog. So I just want to thank all of you guys today for taking the time to be here today and learn about your blood glucose. And I want everybody to have a wonderful evening, and thank you.